Okay. And then while you're here, I'm gonna touch your face one more time, and I'm just gonna have you say, or open and close your mouth. Good job. Okay. I'm going to grab my pen light, and I would dim the lights, and then I'm just gonna have you stare at the object that's on the wall over there, so that way I can just check for your pupil response. Good, and then I'm gonna have you keep staring right there, and I'm just gonna put the light right in the center to look for your corneal. Everything reflects really good on both eyes. Awesome. Okay. What I'm gonna have you do is I'm gonna have you look towards the door. That way, I'm gonna check for jugular distension. Okay, and then will you look at the window over here? Good job. Okay, so what I'm gonna do next is I'm just gonna I'm gonna palpate your carotid arteries on both sides. I'm gonna do one at a time. Good. And while I'm here, I'm gonna look at your trachea. Everything looks good. Take a good swallow. Good. And then your thyroid gland looks good. I'm not gonna osculate that. It doesn't look like it's swollen or anything like that. What I'm gonna do now is I was saving this for the end, so I'm gonna have you just smell this, and I want you to tell me what it smells like.
It smells like mint.
Okay, and then I'm also going to have a taste test, so I'm going to just let you know, or have you let me know what it tastes like.
Tastes like mint as well.
Okay, awesome. And then this might be a little uncomfortable. I'm just going to do a gag reflex, so I just got to check that. So I want you to open your mouth. Okay, thank you. Okay, what I'm going to do now is I'm just going to have you do range of motion of your neck. So I want you to put your ear to your shoulder, and then on the other side. Okay, and then I'm gonna have to put your chin to your chest. Awesome, and I'm gonna move the pillow out from behind you, and I'm gonna have you look up to the ceiling. Good, okay, I'm gonna put this back. Okay, is the pillow okay?
Mm-hmm.
Okay, and then what I'm gonna do now is I'm gonna put my hands on your shoulder, and I want you to shrug your shoulders. Good. And I'm going to move on, and I'm going to go to your arms. So are you able just to put your palms up? And you can rest them on the bed if you wanted. So I would do this on both sides, but I'm just going to assess and look and make sure there's no lesions or bruises. I would notice any tattoos. I'm going to feel for your epitrochlear node, for your brachial pulse, your radial and ulnar pulse. And then I'm going to look, make sure your perfusion's good. Okay. And I would do this on both sides. What I'm going to have you do as well is I want you to grab both my hands like this, and I want you to squeeze. Perfect. Everything looks really well. Is it okay if I cover you a little bit?
Mm-hmm.
Okay, I'm just going to go to the waist. So what I'm going to do is I'm going to listen to your heart, your lungs, and your stomach. So I'll probably do all those all in one.
Okay.
And then I will move on to your abdomen, okay? So first I'm just going to listen to your lungs. Everything sounds good. I don't hear any wheezing or anything like that. So I'm going to listen to your heart now, okay?
Okay.
And do the... Okay, and then are you able to lift your left breast up just a little bit? Okay, and that is your point of maximal impulse as well. And everything sounds good on your heart. So what I'm going to go ahead and do now is I'm going to move on to your stomach. So I'm going to listen to it, and I'm going to listen to your arteries that are there, and then I'm just going to feel a little bit, okay? So that way you know. Okay, so I'm going to have you move your hands for me really quick. Okay, and I'm going to listen to all 4 quadrants for 1 minute If I don't hear anything, I would listen for 5. And then I'm going to switch to my belt, and I'm going to listen to your arteries.
Okay.
So we have your aortic, your renal on both sides, your iliac, and then I would also listen to your femoral and your femoral pulse, and then feel your inguinal nodes. Okay, what I'm going to do now is I'm just going to palpate your stomach a little bit. So I would do it lightly, and then I would repeat and do it moderately and deeply, and then I'm also just going to percuss these quadrants. Everything looks good so far, so I'm going to go ahead and do is I'm going to move on. I'm going to uncover your blanket if that's okay.
Okay.
Okay. Good. I'm going to move this slightly out of my way. Okay, and I'm just going to put my hands on your hips.
Okay.
I'm just going to check for stability, making sure everything's good. Was anything tender when I touched right now? Okay, so I'm going to do now is I'm going to do range of motion of your leg. So what I want you to do is bring your leg out towards me, and then I want you to cross it over that leg. Perfect. And then are you able to keep your leg straight and lift it up? Awesome. And then can you bend your knee and bring your knee towards your chest? Perfect. And while you're here, are you able to I'm just going to push slightly, go this way. And then are you able to cross your foot over that leg? Perfect. Yep. And then you can go ahead and rest it. And I would do this on both sides. I'm going to move to your feet now.
Okay.
So what I want you to do is bring your toes up to the ceiling and then down to the floor. Awesome. And then are you able to bring them out and in? And then what I want you to do, are you able to wiggle your toes? Perfect. Everything looks good. What I'm going to do is while I'm here, I'm just going to check your reflex on your foot.
Okay.
So I'm going to have you just bring your toes up a little bit. Good. Okay. Okay, what I want you to do now is I'm going to put your foot of your bed down so that way you can sit a little bit more comfy. And then I'm going to have you move over to the edge of the bed. Good. And I'm noticing your abdominal muscles, making sure everything looks good. I'm going to go to the back and just assess your back and your lungs. So everything looks good. I don't see any lesions, bruises. Your skin tone looks even all around. What I'm going to do now is I'm just going to go ahead and listen to your lungs in the back.
Okay.
Everything sounds good. I don't hear any wheezing or anything like that. What I'm going to do now is I am going to I'm going to percuss those same spots that I just put my stethoscope on. Okay, so you can feel a little bit of a tap. What I'm going to do now is I'm just going to feel your back with my hands. So I'm going to palpate your scapula as well as your spine all the way down. And then just like before, I'm going to tap on your spine now, okay? What I want you to do is I'm going to put my hands here on your shoulders, and as I go down and move my hands, I want you to say the word 99.
Okay.
Okay, go ahead.
99, 99, 99, 99, 99, 99.
Good. Okay, what I'm going to do now is I'm going to put my hand right down here on your lower back, I'm just going to check for kidney tenderness. So you let me know if this is tender at all, okay? Is that tender? Okay, I'm going to check the other side. What about that one? Good.
And let me first raise the bed to working height, and let me sit up the head of your bed. First, I'm going to assess your eyes. I'm looking at your pupils to see if they're round, equal, reactive to light. Okay, if you can look at the pen light. Okay, thank you. Okay, next I'm testing for accommodation. If you can look at the pen light and then look at the wall behind you. And again, I'm looking at your pupils to see if they dilate and contract. Next, if you can follow the pen light with just your eyes. These are the different cardinal positions. Okay, thank you. Okay, next I'm inspecting the integument on your head, neck, and thorax, checking that the color is even, for any rashes, edema, or lesions. And I'm also going to be checking your pulses. So the carotid pulse, I'm checking both sides one at a time. I'm going to check the radial pulses, making sure that they are equal in strength and regular. I'm checking down to the lower extremities, also in checking the integument for lesions, rashes, or edema. And the lower extremities, I'm going to check the dorsalis pedis pulse and the posterior tibialis. Okay, and then I'm also going to check capillary refill. It should refill within 3 seconds. Okay, you can remain laying down, thank you. Okay, and then if you can, I'm testing strength. If you could lift up against my hands on both feet, that's plantar flexion, and then, no, that's dorsal flexion, and then press down on my hands, plantar flexion. Thank you. Okay, lay down. Okay. Okay, so next, I am going to come back up to the upper extremities and test for strength. If you could grip my fingers and try not to let go. Okay, and then check for capillary refill in the upper extremities. Next, I'm going to test for skin turgor and pinch the skin just below the clavicle and make sure it springs back. Okay, next I'm going to inspect the lungs. Stay, good girl. Okay, so for the lungs, I'm going to auscultate starting on the upper left side above the clavicle, or upper right side, excuse me. This is the right upper lobe above the clavicle on the left, left upper lobe below the clavicle, left upper lobe below the clavicle, right upper lobe, pair 3, right upper lobe, left upper lobe, pair 4, left upper lobe, right middle lobe, pair 5, right lower lobe, and left lower lobe. Next, I'm going to auscultate laterally for the lungs, right upper lobe, right middle lobe, and right lower lobe. And then I am going to assess range of motion. We're going to do abduction and adduction. Okay, next I'm going to auscultate the heart sounds. I'm starting on the right sternal border, the second intercostal space. These first two positions are S2. This is the aortic valve. Next, I'm going to the left sternal border, second intercostal space. This is the pulmonic valve. Next, these next two positions will be S1. This is the fourth intercostal space, left sternal border. This is the tricuspid valve, and then midclavicular line on the left side is going to, and then fifth intercostal space is going to be the mitral valve. Okay. Next, I'm going to assess the abdomen, and I'm going to lay the bed down to do so. And I'm going to be extra careful in the area that she was describing pain. So we're going to start in the right lower quadrant. I am first going to inspect, looking for rashes, lesions, or edema. Then I'm going to auscultate, starting in the right lower quadrant, right upper, and left lower, listening for normal bowel sounds. Then I'm going to palpate, so gently pressing in the same pattern in all four quadrants, feeling for any masses. Okay, next I'm going to go around to the other side of the bed, the patient's left side of the bed. I will assess range of motion on the patient's left arm. So we're going to do abduction and adduction. And next, I'm going to inspect the posterior of the patient. What a good patient. I know. And I'm going to inspect for any rashes, lesions, or edema. I'm also going to inspect for any signs of pressure injury, decubitus ulcers, particularly over the coccyx, or any bony prominences. Next, I'm going to auscultate the lung sounds, starting with pair 1, upper left. This is left upper lobe, right upper lobe. Pair 2, right upper lobe, left upper lobe. Pair 3, left lower lobe, right lower lobe. Pair 4, right lower lobe, left lower lobe. Pair 5, left lower and right lower lobes. Okay, and then I'm going to auscultate the left lateral side, upper lobe, left upper lobe, and left middle lobe. And then I can't remember if I did range of motion on the left arm. Okay, and then I'm going to return the patient the way I found her. Think about like that. And I'm going to raise the bed back up, and I'm going to wash my hands. You've been a very good patient. Thank you.
Okay, so Elizabeth's pupils were reactive to the light. They're equal, round, and reactive. If you'll go ahead and just follow the pen without moving your head. Okay, good. And then if you'll just follow the pen with your eyes. Okay, so Elizabeth's eyes accommodated to that. And let's do the, what was the other thing I needed to do? The red reflex test. So that's going to be a negative on that, and I think that's it for that one. Yep, okay, cool. So let's go ahead and just move on to some facial cranial nerve tests. This is going to be testing your trigeminal and your facial nerves. So I just need you to stick your tongue out, and then if you can clench your teeth and smile, if you can squeeze your eyes tightly shut, and go ahead and wrinkle your brow. Okay, so that's her facial and trigeminal nerves. And we're going to go ahead and do a couple more tests for your trigeminal. So this one is going to test your corneal reflex. Okay, so I'm just going to touch your eye with this cotton and just tell me when you can feel it. Or not tell me, your eyes should react. Okay, so that's good. It's positive. Both of her eyes were blinking when I touched it. The trigeminal nerve is also going to assess for facial sensation. So if you'll just close your eyes and tell me what part of your face I'm touching.
My forehead, cheek, chin.
Okay, great. So let's move that over here. Before I forget, I'm going to go ahead and assess your temporomandibular joint. So if you'll just open and close. And one more time. Okay, so there was no grinding or any popping on that. We're going to go ahead and move on to, I feel like I'm forgetting something. We're going to go ahead and move on to your ears. So let me grab these. All right, if you could just move your hair back for me. All right, so upon first look, Elizabeth's ears are normal. They're her skin color for her race. I don't notice any discharge coming out. There's no swelling or any masses. I'm going to go ahead and feel your auricles here. Do you feel any tenderness?
No.
No? Okay, so those are soft. There's no bumps or anything on those. I'm going to go ahead and take a look inside your ears. And this is going to be your left ear. And we're going to pull your auricle up and back. Alright, so her ear canal is pink. I don't notice any discharge. It looks clean. Her tympanic membrane is a pearly gray color, and there's no swelling of that or protrusions. And the cone of light is at a 7. We're going to go ahead and move on to your right one. Same thing, or up and back. And ear canal is also pink, clean, pearly gray tympanic membrane, and this cone of light is at a 5. Let me go ahead and turn this off. While we're here, I'm going to go ahead and assess your vestibulocochlear nerve. So I'm going to perform the whisper test. If you'll just tell me what colors I'm saying, okay?
Pink, red, green, gray.
Okay, and then if you'll tell me which side you hear my voice from.
My left and right.
Okay, cool. So we're going to do a couple of tests again to test your vestibulocochlear nerve. This is going to be called the Rhine test. So for this one, I'm just going to place it on your mastoid bone, and then you're going to tell me when you stop hearing it. And then I'm going to place it beside your ear and tell me when you stop hearing it.
Yeah.
Yeah. Okay. And the other side. Okay, so your air conduction was greater than your bone conduction on that. So I think that concludes your ears. We're going to go ahead and move on down to your nose now. So her nose is midline. She's not doing nasal flaring, so she's not having any type of labored breathing or respirations are normal. We're going to go ahead and just look inside. If you'll just go ahead and lift your head up for me. So her septum is midline. Her nasal canals are clean. Her turbinates appear a little bit swollen, maybe. There's some congestion. Yeah. And then we're going to go ahead and just occlude one of them and just tell me if you can still. I'm not going to put one on. Is your other still patent?
Yeah.
Okay. So now what we're going to do is we're going to perform a cranial nerve test. This one's going to be for your olfactory nerve. So if you'll just close your eyes and tell me what you smell.
Something sweet.
Okay.
Yeah, it's strong. It's bitter.
Okay, good. All right, you can open your eyes back up. We're going to move on down to your mouth. see. So for your mouth, we're going to go ahead and just take a look. So her lips are pink, they're moist, there's not any cracking, there's not any type of bleeding or swelling. If you'll go ahead and open your mouth for me. Let me get my pen light. We're going to start at the back of your throat if you'll put your tongue down. Alright, so her anterior posterior pillars are as expected. Her uvula lies midline. You noticed your hard and soft palate are intact. Her buccal mucosa is pink. There's not any type of lesions anywhere. It's moist. And then her tongue is midline in her mouth. There's not any swelling or any lesions. If you'll lift it up for me. The floor of her mouth is also good. And her teeth, let me go ahead and look at your teeth. All right, her teeth are pink, not pink, they're glossy, they're white. Do you have your wisdom teeth still? No? Okay, so you would only have 28 teeth. And let me just look at one more time, see if I forgot anything. Okay, good. So for this next thing, what we're going to do is we're going to test your glossopharyngeal. And basically, I'm just going to put this in your mouth and just, you're going to gag. So if you'll just put your tongue, open your mouth for me. Okay, good. And then for your vagus, what we're going to do is just say ah. Ah, good. All right, now we're going to test your glossopharyngeal nerve and your glossopharyngeal and your facial nerve by doing a couple of taste tests. So if you'll just close your eyes. I'm going to place a little bit of this in your hands. If you'll hold your hand out for me. And just tell me what you taste.
Sweet.
Okay, so that was tea. And then same thing if you'll hold your hand out. Oh, that's a lot. Here, if you want to do that.
Salty sour.
Okay, awesome. So that was her glossopharyngeal nerve. I think that's everything for your head. We're going to go ahead and move on down to your neck now. So her neck is smooth. There's not any abnormalities that I can see. I'm going to go ahead and feel all your lymph nodes that are around here. So this is going to be preauricular, postauricular, occipital, tonsillar, submandibular, submental here. And then you've got your superficial cervical chains, posterior cervical chains, supraclavicular, and infraclavicular. And let me go ahead and lift your arms up. And axillary. Okay, so I didn't feel any of your nodes, and none of them are palpable there. And I'm going to go ahead and feel your carotid pulses. So it's 2 plus. And 2 plus on that one. And then I don't see your thyroid, so I'm going to go ahead and assess for it. If you'll just swallow for me. Okay, cool. So your thyroid was palpable there, but it doesn't feel abnormal or anything. I'm trying to remember if I did the other facial ones, but I think I got it. Okay, so we're going to go ahead and take a listen to your carotid arteries and to your thyroid, just to make sure everything's okay there.